What do you think about when you hear about hormone pellets? Do you immediately think about only having to do something about your testosterone just like 2 to 4 times a year and the incredible convenience of being able to do that? Or does your mind jump straight to whether insurance covers it and what's the price? So let's talk about that. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrative Medical right here in Amarillo, Texas. And from the start, I want to encourage you to share this information with your friends and your family because I promise you, hormone balance, this affects almost everyone, so they could really use your help. Now, the lack of insurance coverage for testosterone pellets, it can definitely be an obstacle. But when a person gets hormone replacement pellets, not only are they paying for the incredible benefits of feeling better and all that good stuff that we'll talk about, but they're also paying to save their time, and they're paying for incredible convenience. Now think about it. With gels, you have to be consistent with putting the gel on every day and then kind of cleaning up the mess. The gels stink, by the way. They don't smell good. And not only that, but the warnings on the gel labels, they're very clear. You have to make sure children don't come into contact with it. And that goes for straight out of the bottle, but they also can't touch you if you've recently applied the gel. If they do come in contact with it, they get a dose of testosterone that may speed up processes within their own little bodies that nobody wants, of course. Now with the injections, you have to go through the pain and the process of testosterone shots at least every week, and sometimes it's more often than that. You have to remember to pick up your prescription. You got to remember to stay stocked on the needles and the supplies. And several patients have to have another person administer the injections because, let's face it, some patients are pretty squeamish about needles, and that's just to say the least. Some of them are downright frightened. So with testosterone hormone replacement pellets, a simple 15-minute procedure that you don't even feel lasts for up to 4 months for females and up to 6 months for males. Now that means our patients get the benefits of hormone replacement and optimization all year long, but only have to remember to do something about it like 2 to 4 times a year, depending on the gender. And that saves time, and that is convenient, folks. And kids can't get into the pellets, right? So it saves time spent getting the prescription, time spent getting the supplies, time spent getting the injections or using the gel. And isn't it incredibly convenient to turn a daily or weekly treatment regimen into just a 2 to 4 times per year thing? Of course it is. The cost of treatment, it's not much different than when patients get the injections and gels, but they're getting the same treatment in a different way. And when you mix the hormone replacement with the daily supplements supporting the hormone pellets, our patients report incredible changes in their lives for the better. More energy, increased libido, fewer headaches and or headaches that are less severe when they get them, less fussiness. They're easier to be around on a day-to-day basis. And not only does hormone replacement help with mood swings, chronic fatigue, migraines and headaches and libido, but it also helps with building lean muscle mass, weight loss, and brain health. And this is why an effective hormone replacement program is essential for patients looking to improve their health and well-being. If you're from Amarillo area or you're going to be passing through and you need to be seen by our nurse practitioner, our chiropractor, our acupuncturist, or our massage therapist, why don't you call us right now at 355-3000 and let's make it happen. Let's get you on the schedule. If you're watching on YouTube or Facebook, please subscribe, like, comment, and share all the things. Until next week, take care of yourself, and we'll see you then.